Welcome to another edition of Inside Guyana. Today in our studio in Long Island City, ITV studio, we have in the program Inside Guyana a prominent Guyanese who's been living in the United States also for some time and working in the United States in the field of healthcare and internet technology. So, ladies and gentlemen, please join me in welcoming to our program Mr. Colin Haynes. Welcome to the program, sir.
It's a privilege to be here. Thank you very much, Rudy.
I understand you're a healthcare, IT, and international development consultant in Maryland.
Yeah.
Is that so?
Well, healthcare IT is a pretty much a new field which deals with installing, implementing, training of electrical medical records. As you know, with the Affordability Care Act, which is called Obamacare, there's a lot of money and incentives being pushed for hospitals to get on stream with electronic medical system. Okay. And so one of my roles is to be able to develop training programs, do training as well, and also support when these softwares go live. There's, on average, it's $100 million. These projects are, and so they're very robust. They cover a lot. They cover doctors, nurses, about 50,000 people are trained all the time.
Very good, very good. Well, Mr. Colin Haynes, you probably may not know, but on the program Inside Guyana, we normally ask our viewers to introduce themselves. How would you introduce yourself? Tell us a little bit about your background. Mm-hmm. Before you came here, you had to be born somewhere, probably in Guyana, I guess.
Yes.
And you have sisters, brothers, you went to school, and where did you get your education? And probably you can tell us a little bit more about where you worked up to this point in time.
Certainly. I was originally born and raised in Linden, Guyana, Region 10. I grew up in a very diverse setting. My great grandmother was European ancestry. My grandfather was an Amerindian. It was an Arawak. My grandfather as well.
You don't seem to have any of that in you.
Well, yeah. It's there. My grandfather as well was an Arawak as well, and my great grandmother had married a guy from Afro descent from Belladrum, and so that's why we appear with this tone. Grew up in Linden. Grew up alongside my great grandmother. One of them was European. The other one was Portuguese descent. So a lot of their upbringing had affected me. I saw a lot of diversity. I saw Guyana for truly what it was, a diverse nation. And my core values were family and integrity and commitment. That's where those was developed. I went to Mackenzie High School until my last year of CXC. I had to migrate to come to the U.S., where I continued my high school education here, and then afterwards I went on to study in college. I went to Washington Adventist University, and I studied a bachelor's in biochemistry. I also have a bachelor's in international relations. In my international relations, I studied Latin America, which was always my area of interest. I was always intrigued about the Caribbean and where I was from, and also I did some. I know you're a big fan of Russia, and so part of my study in international relations
not a fan, but
was
I had a scholarship.
You studied there,
at
right?
Moscow State Lomonosov University, yes.
And so I studied Russian American foreign policy quite in depth as well, and Russian American foreign policy with peacekeeping. To look a lot about the Cold War and even the influence on Latin American states, particularly Guyana.
I was part of the process that ended the Cold War.
Right. And we spoke about that. My thesis was actually drug trafficking in the Caribbean, where I looked at the problem of drug trafficking and some of the solutions and the recommendations of how we could push this from a very grassroots level from in our schools and get our youths off of addicted. We have a lot of youths who are addicted to drugs and so forth. And so I put a policy paper forward to address some of those issues. After I finished college, I went on and studied my master's in public health and international development at Loma Linda University in Southern California. During that time, I've worked in disaster risk management and climate change. I did some work for the International Institute of Rural Reconstruction in the Philippines, advising them as part of a team. How do they address health issues during flooding?
So you actually went to the Philippines?
Yeah, went to the Philippines and Taiwan, and did some work there over a period of time. There is a position paper and a report I've also developed and shared that with their governor and their mayor as well, of the city of Silang and Cavite in the Philippines. That's the southern part of the Luzon Island. And so while out there, I found that a lot of our problems in the world are very universal. We have some of the same issues we're facing in terms of international development, which would be poverty. It goes beyond healthcare, but poverty, job creation, the environment has a big part to play. And so a lot of my experiences have been a very holistic experience. And so my also dream has always been to return back to Guyana, and I've had some of that experience. I returned to Guyana last year, and I worked for UNAIDS doing research into the HIV response, both on a local level, international, and a government level. And so I was able to be part of a team to write the Guyana HIV response report. It's called the GARP report, that went up to Switzerland, to Geneva, to be reviewed. And then afterwards, I recently finished up a project with the Global Health against HIV and TB, where I worked as the National Monitoring Evaluation Officer for Guyana, working alongside in the coastal regions, Region 2, 3, 4, 5, 6, and 10, to basically ensure that our data mechanisms are clean, we're capturing the right reports, we are projecting the right image and the right projections of what the real issues are in HIV as it relates to care and treatment, and also ensuring that the donor gets a bang for their buck, ensuring accountability and transparency in the funds. Because monitoring evaluation, I realize, is a very important tool, because research and numbers tell a story for every country. And in Guyana, we've been a little bit behind the 8 ball on that, and so we need to continue working in that area and improving reliability.
Well, that's a long introduction of yourself. Well, I guess I must commend you for having made such achievements in your life in a short life. You're still a young man, and you have achieved so much already. And I think the people of Guyana should benefit from your expertise now that you've acquired that in many different countries, and you've elaborated so much here so eloquently today on our program inside Guyana. And you said you have inclination to go back to provide services to the Guyanese people and to the government of Guyana. So are you aware of anything that is happening in the Guyana healthcare system? What is your general overview, if any, of what is taking place in the healthcare environment in Guyana?
Well, our healthcare system, and I've been in Coastal healthcare system for about 2 or 3 years now, we're going through an institutional crisis. And when I mean an institutional crisis, I mean that our hospitals, our health centers, and our clinics.
When I hear crisis, I think of a fire. A lot of people dying, and people getting killed, and you're running all over the place.
Well, our data and our statistics are not something to brag or boast about, and we're losing 70 mothers a year to maternal deaths.
How many?
70 mothers a year.
17?
70.
70.
Yeah. From 2000 to 2013, we've lost 1,400 mothers, according to the World Health Organization report.
What?
So yes, the maternal childhood deaths. This is between 1990, when we instituted, and I make that correction, between 1990 and 2014. What is more shocking about that statistic?
Oh, so 24 years.
Right. However, in the last 14 years of that number, we've lost 960 mothers to maternal childhood deaths. That's 70% of all maternal deaths have happened in the last 14 years. And given that we were getting this rush when the Millennium Development Goals came about, And those came about, and one of the ones were to reduce at least by half maternal and childhood deaths. So,
I am more inclined to look into specifics here. You said 900 mothers died over the last 14 years. Do you have a breakdown as to what are the causes for these deaths?
well, some of them, Rudy, are as a lot of it. What we've been seeing in the data is not access to hospitals, not access to care, but most of it's the procedures. So when a mother goes to the hospital and she's going to have a baby, the birth attendant or the skilled birth attendant, if it's in the rural areas, there's a breakdown in the training and delivery in being able to execute or deliver a baby successfully.
The midwifery.
C-sections that happen with the surgeons. We have a lot of cases now where mothers are delivering babies, and there's many complications that are not being tracked, whether it's before or during the period of time, and so we end up losing a lot of our mothers.
So what would you recommend at this point in time?
Well,
now that you've observed what is happening, and you are not happy with that, and you find that there's something can be done, what, from your perspective, with your experience and expertise, what would you recommend?
Well, in the beginning, I wanted to touch back a point when I said an institutional crisis. For any institution to function, and this came a lot from my training and experience in the field, they need to have three things. First is education or training. And so that sort of drives what the theory and the practicality is to tackle any issue. The second one is research, and Guyana is a country we're behind the 8 ball on that, and so we need to have a lot of work being done in actually conducting research, and research includes not only surveys and data, but also coming up with innovative ideas and have them tested and have them built for precision, so there's reliability in conducting our C-sections, in our deliveries, and so forth. The third one is service. A lot of our issues in our healthcare system comes down to entering the hospital setting and not being able to get the quality service. We have to look at our public health system and our public health care system as one in which our patients are our customers, and they are paying us through their tax dollars to be able to effectively treat them, not rush or give them maltreatment, but from the gate when they're sick all the way onto the unit and out through the door. We have to have exceptional customer service.
You mean a comprehensive care.
Service, a comprehensive care. Care doesn't begin. A lot of us think that when we roll into the ER, that's where care begins.
So
no.
Are you saying that this doesn't exist in Guyana? They don't have comprehensive care for patients when they go to the hospital?
Well, the thing with Guyana is we are making strides in some areas, but we are also lacking in many other areas in this.
For example?
For example, one time I took my grandmother to Georgetown Public Hospital, and she's getting out of the car, and she's 73 years old. And there is a service where they would help the elderly or folks who can walk in with wheelchairs. When you go to the ER here as well, they do that as well. And all of these chairs I'm seeing that are stacked up there, but there's a service, the government pays a contracting service to be able to wheelchair folks into the ER, into the different doors, into the different levels of care, whether it's triage or treatment or evaluation. And imagine that morning where many people are coming in the same time, and that is missing. So those that are sick, they would have to make that extra step, which can aggravate if someone, had fractured a leg, or someone who have hypertensive, an hypertensive burst where they have hypertension is high and their balance is off. They can't walk, they can fall down right there.
So the services are there, but it's not consistent.
Right. So we have to have a lot of quality assurance We have to have a lot of customer service driven in our healthcare system. This is an important area, and the private hospitals are doing a very good job at it. And so folks now are skipping our healthcare system and going private, and they don't mind paying the extra money, because when wherever they go, they're going to get treated, they're going to get looked at in a quicker way, in a more effective way, and the evaluation and their health situations are going to be explained to, and they have a sense of that, yes, I'm spending my money, but I'm getting my money's worth. And we have a public health system where we're paying into additionally, and we're not getting that as well. And so those are the areas we need to work on.
So I've been reading in the newspapers of maternity death and infant mortality in Guyana, and it's being like very high. What are some of the factors that affect or influence that high rate of mortality, maternal mortality and infant mortality?
It has to do a lot, like what I'm saying, coming back to our training and our service. Right now, we have a lot of our doctors who they're well trained. They go through pretty good medical training, but when it comes to scenario cases where there's complications with pregnancy, some of the complications, now they're added to things like chronic diseases, HIV, and so forth. And whether we're able to track our mothers before they're coming to these hospitals with these complications. And so when they get there, we know who that patient is, and we're able to effectively decide a plan of care and treatment for that. I think a lot of that comes through with their continuous training in terms of their residencies. They've left medical school, their residencies. Are we ensuring that they have enough trainings for these scenarios? One such case is in the delivery of babies, C-sections. There's a World Health Organization has what's called a timeout, which is, regularly you going into a procedure, you would have Dr. Rudy, we're removing your right leg. We ensure, is this Dr. Rudy's right leg? Is it marked? Do we have the scissors? Do we have the cotton wool? Do we have swabs? Do we have the lidocaine anesthesia? If we're putting in 10 cotton wools in the middle of surgery, do we have these 10 cotton wools? Do we put them in? We count them, we take them out. At the end, do we have all the things that we started with? We can account for them at the end. And so we're finding cases where there's some negligent behavior by our physicians, leaving these cotton swabs inside of patients. And that is very, very dangerous, because they can rupture organs, and they could, they start to rotten inside of you, and it's a terrible issue. And this should not be happening after we're spending all this money in healthcare, and we have the WHO timeout checklist that we can implement. It's a simple thing. You implement the checklist, you ensure the reliability means that it's happening every single time at every single hospital, every single health center where we're doing these C-sections. And I think that one of the areas we have to improve on is our regional health services.
Before we move on to that, are you aware of any legislation in Guyana that would make the physicians who are negligent to that extent culpable by law?
So far, we haven't had any.
No, do we have legislation?
No, we don't have any legislation so far. And I think that's one of the areas we need to move to. We need to move to malpractice, not because we want to, No,
malpractice is different from negligence.
Well, yes. Yes and no in some cases.
If you leave a scissors or a gauze inside of a patient on who you've operated as a physician, as a surgeon, that is not malpractice. That is negligence, gross negligence. And therefore, you should be culpable. and you should be imprisoned as far as I'm concerned for that. So if we do not have legislation to make these types of behavior by whoever culpable by law, and these people must be penalized by law, we cannot resolve with that easily.
Yes, and that's true. And I think we need legislation in place. I think we generally need to be able to hold our doctors and nurses to a high level of service and a high level of professionalism and technicality. And so some parts of the bill has to be able to reflect those. But I cannot overemphasize that we need to go back to the proactive stages of ensuring that our education, our training, our research and service, customer service is implemented efficiently, because this will erase at least 70% of the issues we're facing in our health sector today.
Mr. Colin Haynes, let us talk a little bit about infant mortality. I think this week, last week, we heard of some infant falling off the bed and injured his head or something like that. What is going on in that area?
Well, the statistics shows for the Latin America region, this is not only unique to Guyana, but Latin America region for the last 10 or 15 years developing and implementing the Millennium Development Goals. We've basically moved our ratio of child deaths, child deaths under 5 neonatal, from somewhere between 70 to 75 to just now about 68. So we haven't been able to move that marker far. Guyana currently sits around 65, 68. So we're still losing a lot of babies. And a lot of this can be attested to the procedures of care that happen, going back to training of our nurses, because to be a nurse in today's society is a very caretaking profession. And the doctor would come and go and make recommendations for treatment, but a nurse is essentially the mother of that child or the mother of that patient while they're in a hospital. And so it requires them to be able to be able to respond fast to changes in care, to be able to effectively advise both the patient and the doctor on ways forward, recommended ways for care as well. I think those areas are lacking, and yet we cannot go back to the training. I think we need to review our nursing program and ensure that we are not only giving them theoretical training, but over the course of their training that they have real life situations, and they're doing that. They are in the hospitals, but I'm not thinking that they're being exposed to some of these real life consequences that are happening. And I feel the more we get them close and comfortable with high level of patient care, like ICU, med-surg, surgery, that kind of stuff, I think we're going to move the ball a lot much more closer in terms of being able to be effective and have our nurses being able to execute at an effective level.
Mr. Colin Haynes, Healthcare IT International Development Consultant. We heard your long biography, you traveled around the world. Guyana has made a headline recently as becoming the country with the highest suicide rate. How would you advise the Guyanese people and probably the government, probably the Ministry of Health in Guyana and other organizations to tackle and probably eliminate this problem of suicide?
I want to draw back on some of the comments our president said about suicide. His Excellency David Granger, President of Guyana. He said that healthy people, or happy people rather, don't commit suicide. They don't kill themselves. And that's one of the core
So let us all be happy, dance and drink rum
well,
and die.
it goes beyond that.
Okay.
It goes beyond that, Rudy. And what I was coming to as well is that there are what is called social determinants of healthcare. Social determinants essentially saying that to every person who lives in a society, there are some norms that drive
You
their
mean
behaviors.
determinants or deterrents?
Determinants.
Okay.
Not deterrents, determinants. So, for instance, Colin Haynes growing up in Linden, in order for him to be the most successful person, he needs to have a stable family. He needs to have economic stability, whether it's his family or itself as he grows up. He needs to have optimal health, mental health. Health is not only looked as just the physical or the absence of diseases, but it's also mental, physical, psychosocial, spiritual in some cases. Spiritually, what our belief core is, our systems are, those are all driven. And so suicide in Guyana finds itself as a very complex block. We have, and we're happy in Guyana to have people who are bounded by different cultures, different ethnicities, and they share different values. And so dealing with a man from Albion who is bounded by a different environment, the environment plays a great role as well. You know, we had an interview with our sugar expert talking about the sugarcane workers. Their experiences in the field are very unique and very different from a guy living in Albion. And so the crossroads is that we have to ensure that the access to health or the access to these services for suicide, they are made unique for the different areas that we live.
For example, what kind of services are you talking about?
There are two things we need to be able to zero in on. Is that we need to ensure that our adults are okay, in terms of okay being physical, financial, spiritual, mentally, that they're achieving optimal health in that area. And this is where counseling comes in. We need to be able to make sure that we have counseling services readily available in all the communities, or they have access to these counseling services. Recently, they've instituted a sort of a hotline where people can call in. One of the things we suffer a lot in Guyana is stigma. I had a dear friend of mine, and we've heard it in the news, who just committed suicide. You know, I talked about the UNAIDS. She and I worked on that report for UNAIDS together.
She committed suicide?
Yeah, it was very distressing that this individual has committed suicide. She was always looked to be happy.
I hope it's not because she fell in love with you.
Oh, come on, Rudy. But when I got that news, it triggered me to think in different levels. That we may see someone in a professional light who is fine, we have that checked off. Physically fine, that's checked off, they don't have any diseases. But coming down to, you know, family issues, the environment we live in, we have to ensure that we're creating and having those environments, those unique environments where people can thrive in. And if they have issues, we need to move to a society that have greater confidence in our friends, in our families, in our healthcare professionals like our counselors, who are going to be able to be there by our side and advise us and tell us that, you know, and give us recommendations how we can move forward in different areas. And so a lot of the suicide we see happening is as a matter of social issues that I've outlined here. And so I think counseling is important. For kids, you know, we can give our kids a lot of uniforms, we can give them good books, we can give them good transportation to go to school. But when a child goes to school, he's not only taking those books and the uniform and the shoes, but he's also taking issues he's seeing happening in his immediate environment, his family, his neighbors, the wider community. And is that going to be able to create an environment where he can effectively concentrate and be able to carry out his studies? And so at the elementary level, we need to institute and make more reliable our counselors in the school system. And so this is a collaboration here between the Ministry of Health and Education, and this is a unique opportunity that we can do to move forward the conversation on suicide.
What do you think from your perspective and your experience? Is it wise to recommend to the government to have a television program, national television program, and have people who possess the expertise on these subjects like suicide to keep it there like regularly for a period of time so that people can listen to them and get their minds off, probably put their minds on the right track. And that might be helpful. What do you think?
I think it's an excellent idea. I think being able to occupy our minds, help them to be driven by culture and the arts, and we have a very good and thriving industry in culture and arts. And I think that if we can be able to move the conversation there, I know there's a lot of work being done. For instance, one of my good friends, Dr. Margaret Lawrence, she's doing a great job with Murundai.
Margaret Lawrence and I performed in the Theatre Guild.
Exactly, and so
a long time ago.
she has a great program. It's been funded, and so she's doing some work, and she's doing a good job, I must say. I want to commend her for that in being able to move arts into the issues that we're having, and hearing them on the radio is very comforting to hear some of these same real issues that people are going through, those being expressed there, and also there are solutions. So folks who are listening, they can say, you know what, I can recognize, I can identify with that, and there is light at the end of the tunnel. And I think also, and I want to be able to emphasize a little bit more strongly to our viewers that we have to move a little bit from a culture of feeling stigmatized. I think we and sometimes stigmatize our issues by not being able to effectively confide in someone, or be able to take comfort in help of a friend, a family, whether a counselor in school or in our communities and so forth. And I think the more we open up and have an honest discussion that we do have real issues, I think that is going to help take us a little closer.
So you're recommending more socialization.
I'm recommending more conversations, more open conversations from folks who are struggling with suicide. There's an interesting statistic I've just heard from the Ministry of Health that 1 out of every 5 persons in Guyana are thought about committing suicide. Among the health sector, they did a survey as well, and 5 out of 10 of a large group of health professionals have contemplated suicide. So it's even in the grain of our own system that is supposed to be made to erase some of these ills.
I think if we were to reflect on our history, our own history, this problem of suicide didn't exist all the time. It became worse, probably. It existed, but not to the extent as it exists today. And we look at the social environment, let's say, pre-colonial times. We had community centers. We had playgrounds.
Right.
We had handicraft centers. We had home economic centers. We had community activities. We would have, let's say, the religious groups would come out and have a weekend or one day over the weekend or some big event. Not everyone would go to every event, but at least some sections of the village or the population in a region would go out there. And this is how the interaction and the communication among people would be catalyzed and sensitized. And people become more friendly to each other. But somehow we only hear is this big stadium parade and this big thing once in a while, and only, let's say, 20,000 people can go there. Whereas if you have it in all the different villages,
We hundreds of thousands, the whole
you have
population.
exactly, you're going
Yeah.
to have more than half the population being involved. So I think this is one of the recommendations I want to
Yeah.
put forward here, to have more social events and community activities in the locations, in all the various locations in Guyana, not only centralized.
Just to wrap it up
yeah, before we can continue, Mr. Colin Haynes, while we're coming to the end of our program, I just want you to reflect a little bit on the strategies here and some solutions that you might want to recommend, showing the way forward in our healthcare improvement in Guyana.
Well, the core of our healthcare issues, I think it falls within the bracket of the regional health services. This is where we have to effectively manage our hospitals, health centers, and clinics. And regional health services is so important to the functioning of our health sector, because it's where all our people are. They are in the regions. And so we need to make sure that they are access to services, whether they're counseling, they're preventive mother to child, labor and delivery, maternal child health services. I think we really need to get those services available at the lowest level, at the grassroots levels, our clinics, our health posts, whether it's in the rural areas and interior, region 7, 8, 9, 1 as well, and our coastal areas as well. We need to ensure that there is broad access, even when we're talking about chronic diseases, that there are services like being able to preventive services such as blood sugar, blood pressure, stroke as well. We need to be able to effectively increase access at all levels, not only at the top tier level where we had the Georgetown Public Hospital, or we have the top regional hospitals, but the district hospitals need to have the capacity as well. The health clinics need to have that capacity in the towns. The health posts in the rural areas need to have that capacity as well.
What about if we have mobile testing vehicles going around?
Mobile does the job, and the Ministry of Health they have been improved in this area of reaching. I know they're doing mobile dentistry, they're doing mobile health services right now, but to me that is not the most sustainable solution. I think the most sustainable solution is understanding that a mother lives in Wakapao, she's going to be able to effectively deliver a baby at the health post in Wakapao, as opposed to having to take that long trip by boat on the river, then to Sadi. That takes long, and with time, a lot of things can complicate situation. So I think the way going forward is to be able to maximize our access. A lot of our health problems around the world, I've seen this here, I've seen this in Asia as well, is a matter of access to services. That is one of the major things there is. If we can improve on access, improve on effective access, and efficient access as well, I think we can take care of at least 80% of our issues in our health sector. Another one is for us to be able to improve our education, our learning programs, so that we can have the best health professionals. We bring them in from different countries, including the University of Guyana as well. So we have to retool our curriculum to ensure that we matriculate the best and the brightest healthcare professionals to serve in many different areas in our country.
Now, Mr. Colin Haynes, we are going to wrap up here, but I want you to say a few words about climate change. I understand you did some studies in that area as well. Would you want to share any views on climate change, since that seems to be one of the topical issues nowadays?
Yeah. Climate change Guyana finds itself as a unique position for climate change, in that we have about 60 to 70% of untouched reserve forests in the world. It's probably one of the largest untouched reservation of forests in the world. But and we have a low carbon development strategy that was instituted to capture monies to be able to effectively preserve our environment. So Guyana now comes on as one of the green environments, one of the green countries, and our former president Bar Jagdeo, he's been doing a lot of work for that, and he should be commended on those ideas.
He's the champion of
Right.
the world, of the earth.
Right, and I think we need as well to go a little further into that. You know, we're collecting funds from Norway, about $200 million we're supposed to receive for our preservation of our rainforests. I think we can use a lot of that money in terms of boosting our economy, boosting our green economy. So that is creating paper factories. You know, Norway does a lot of shipbuilding. You know, why don't we have Norway come into Guyana and build ships? We also need to work on having a reforestation plan. So we are cutting down our forests, but we also need to have a plan to keep developing our forests as well, because that's ensuring sustainability of our environment. The climate change also extends now as well, even to our seas. You know, our seas are now, the levels of our seas are now varying. They're fluctuating very rapidly. You know, you've seen a couple of times we have whales that are pushing up on the shores of our sea because the water level is very low, and so whales are finding themselves too close to the shore many times. And so we need to have scientific data to drive what these trends are, how they're changing. And marine diversity is one of the areas we should use a lot of these funds to be able to investigate some of these changing trends that are happening. On a local level, we need to be able to ensure that we're keeping our waterways, our drains, our city clean. That is going to help with the effective drainage of our cities, reduce the impact for flooding. With floods bring health issues. Mosquitoes as well. So we have dengue,
snakes,
fever, chikungunya has been one of the latest issues as well. And so climate change finds itself as an essential fabric in terms of the economic, social, and even political development of our Guyanese people. And so we need to retool that strategy to capture how do we have an overall and overarching development for our country moving forward.
Thank you very much for that insight into climate change, Mr. Colin Haynes. I'm sure our viewers will be reviewing what you said and see how much sense it makes to them in their own time. And right now you have a few minutes more to give your final conclusion to our ITV viewers without me asking you any question. Sir, please go ahead and look at our viewers in the eyes and tell them what you feel from your perspective.
I think the future of our nation is bright. I think that we are working to correct some of the social ills within our country. However, it's going to take a lot of bold leadership. It will come from a sort of what's called a political, social, and economic development plan. And I think that we need to be able to effectively move our country forward by creating more jobs for our people, be able to address some of the social issues such as our healthcare system, our education system, ensuring that we're matriculating some of the best and the brightest young people in our country. We also need to shift the conversation as well into political involvement, ensuring that both our young people and other population that are equally represented in all forms of government. We need to ensure that we have a representation that it reflects that of gender balance, youth balance, and also a regional representation as well, because Guyana finds itself as a very unique position geographically, and so sometimes what happens in an urban area, we need to be able to have that insight from a rural area as well. And so I think that the future of our country is basically us working forward for a better plan of development and correcting some of the ills that have happened in our past, and for us to all collaborate. Guyana is a land of 6 people. It's a great nation, and we can do quite a lot by working together, all races coming together, because after all, we're one people, one nation, and one destiny.
Thank you very much, Mr. Colin Haynes, for coming to our program Inside Guyana.
Thank you.
I'm looking forward to having you in future on our program again. Very insightful discussion we had here today.
Thank you, Rudy.
Thank you very much.
My pleasure.
This is Dr. Rudy Jadoopat reporting for the program Inside Guyana on ITV in Long Island City, New York. Until next time, all the best.